Spinal fractures sound frightening, and for many people, they are. But what often makes them even more stressful is not understanding how they happen or what to do next. If you've been dealing with back pain after a fall, an accident, or even without a clear injury, you're not alone. Many Americans experience spinal fractures every year, especially as they age or if their bones become weaker over time. A spinal fracture is a break or crack in one of the bones in your spine called vertebrae. These bones stack on top of each other to support your body, protect your spinal cord, and allow you to move freely. When one of them breaks, even slightly, it can cause pain, stiffness, and changes in posture. For some people, spinal fractures happen suddenly after a car accident, sports injury, or a serious fall. But for many others, especially adults over 50, they can happen from something as simple as bending, lifting a grocery bag, or slipping in the bathroom. It's often because of osteoporosis, a condition that weakens bones and makes them more fragile. Lifestyle plays a bigger role than most people realize. Low physical activity, poor nutrition, smoking, heavy alcohol use, and long-term stress can all weaken bones over time. A diet low in calcium and vitamin D can silently reduce bone strength. Spending most of the day sitting at a desk or on the couch can make muscles weaker and posture poorer, placing extra pressure on the spine. Aging also changes the body. Hormonal shifts, especially in postmenopausal women, can accelerate bone loss. Men are not immune either. As we get older, our bodies naturally rebuild bone more slowly than they break it down. Over time, that imbalance can increase the risk of fractures. The impact of a spinal fracture goes far beyond physical pain. Yes, pain is often the first sign. It may feel sharp and sudden or dull and constant. It might get worse when standing or walking and improve when lying down. Some people notice they're getting shorter over time or developing a forward-leaning posture. But the real effect shows up in daily life. Simple activities like getting dressed, carrying laundry, or driving to work can suddenly feel overwhelming. You might avoid social events because sitting in a chair for too long hurts. Sleep may become restless because it's hard to find a comfortable position. Over time, lack of sleep affects your mood, focus, and energy. Back pain can make you move less, and moving less can weaken muscles even more. This creates a cycle. The weaker your muscles become, the less support your spine has. That can increase the risk of future fractures. Emotionally, spinal fractures can be draining. You might feel frustrated that your body isn't cooperating. You might worry about falling again. Some people start limiting their activities out of fear, which can lead to isolation or even mild depression. When pain interferes with independence, confidence often takes a hit. For older adults, spinal fractures can significantly affect long-term health. Reduced mobility increases the risk of weight gain, heart issues, and diabetes. Less movement also affects digestion and circulation. In severe cases, multiple fractures can compress the spine and affect lung capacity, making breathing less efficient. The good news is this: there is hope, and there are practical steps you can take to strengthen your body and reduce your risk. Let's start with daily habits. Movement is one of the most powerful tools for spinal health. You don't need intense workouts. Simple, consistent activity makes a huge difference. Walking for 20 to 30 minutes a day helps stimulate bone strength and improve circulation. Light strength training using resistance bands or small weights helps build the muscles that support your spine. Focus on exercises that improve posture and balance. Gentle yoga or Tai Chi can strengthen your core muscles and reduce the risk of falls. Stronger core muscles mean better spinal support and less strain on the vertebrae. If you already have a fracture, always consult your healthcare provider before starting new exercises. Physical therapy can be incredibly helpful. A trained therapist can guide you through safe movements that protect your spine while rebuilding strength. Nutrition is equally important. Calcium is essential for bone strength. Dairy products like milk, yogurt, and cheese are common sources. If you prefer non-dairy options, look for fortified almond milk, soy milk, leafy greens like kale, and canned salmon with bones. Vitamin D helps your body absorb calcium. Spending a few minutes in sunlight each day can support vitamin D levels. Fatty fish like salmon and mackerel also help. Some people may need supplements, especially in areas with limited sunlight during winter months. Always talk with a healthcare professional before starting supplements. Protein also matters. Your bones and muscles rely on adequate protein to repair and rebuild. Include lean meats, beans, eggs, nuts, and seeds in your meals. Hydration plays a role too. Staying well hydrated helps maintain healthy discs between your vertebrae and supports overall circulation. Next, let's talk about fall prevention. Many spinal fractures happen because of falls. Make your home safer by removing loose rugs, improving lighting, and installing grab bars in bathrooms if needed. Wear supportive shoes with non-slip soles. If you feel dizzy frequently, have your blood pressure and medications checked. Mental wellness is another piece of the puzzle. Chronic pain and fear of re-injury can increase stress levels. High stress raises inflammation in the body and can interfere with healing. Practice simple stress-reducing habits like deep breathing, gentle stretching, journaling, or short daily walks outdoors. Sleep is critical for recovery. Aim for 7 to 8 hours each night. Use supportive pillows and a mattress that keeps your spine aligned. Establish a calming bedtime routine to help your body relax. Long-term prevention requires consistency, not perfection. Schedule regular bone density screenings if you're over 50 or have risk factors. Early detection of bone loss can prevent future fractures. Avoid smoking as it directly weakens bone tissue. Limit alcohol to moderate levels. If you've already experienced a spinal fracture, don't assume it's just a one-time event. Take it as a signal from your body. With the right plan, many people regain strength, reduce pain, and return to activities they love. Remember, healing is not always instant. It takes patience and daily effort. Small changes add up. A short walk today, a balanced meal tomorrow, a strength exercise 3 times this week. These simple actions build stronger bones and a more resilient body over time. Your spine supports you every single day. Supporting it back through mindful movement, nourishing food, stress management, and preventive care is one of the best investments you can make in your overall health. With the right habits and guidance, your body can rebuild strength and protect you for years to come. Start where you are. Take one small step today. Your future self will thank you.